Machiegni kero nyakon magajwang chenro en rameny piny wadhi mbele gi weche manyien. Tanderuok ma jochiw thieth mong'ere kaka Kenya Union of Clinical Officers KUCO onyiso ng'ur margi ewi midhiero ma gisebedo ka gikale kendo singo chako ng'anyo kiny. KUCO oseo sirikal kuom rem chopo winjruoge ma gisebede kinde mokalo koting'o bero lwasi margi mar tich. Gotieno Daniel nigi ler.
Kotelnegi gi jagoro maduong' mar riwruogno mar Kenya Union of Clinical Nurses, Jochiw, jochiw thieth go oseo piny owacho kuom rem loso romo mar twak ewi winjruok mane giketo, rem chwalo ngas mamalo jochiw thieth, rem miyogi okumba manyien mar thieth mar SHA e kinde mamoko.
And therefore, there is also lack of commitment toward the promotion and the redesignation of clinical officers in accordance and strict conformity to their career progression. This is affecting most of the counties. Failure to provide comprehensive medical cover for clinical officers by some of the county. This is not most because they are only around 14. Inadequate recruitment of clinical officers to bridge the existing service gaps necessary for realization of the universal health coverage under Taifa Care.
Jochiw thieth go ma yango ni gichako ng'anyo margi sa 6 mar otieno ma kawuono okwedo okang' mar weyogi oko mar romo maduong' mar thieth ma otagi jalup jatend piny Kithure Kindiki ka giwacho ni lokruoge iketo sekta mar thieth ma ok onywand pachgi.
There is a conference that has been called at the office of the Deputy President, which started today. None of the clinical officers' leadership were invited. And yet, they are discussing about issues affecting Kenyans, issues of health that are affecting Kenyans, and no clinical officer, even of the 30,000 clinical officers.
The Kenya Union of Clinical Officers wish to inform the public and all the stakeholders of the resumption of the industrial action effective midnight today. That is 17th day of February 2025, following the failure of the Council of Governors and the Minister of Health to address our concerns and fulfill the commitments made after the suspension of the 21 days strike.
Komachielo, e kaunti ma Kericho, riwruok mar lakteche KMPDU ochiwo ote mar chako ng'anyo tok ndalo 14 poni tend Kericho okoketo e tim winjruok mane giketo e kokgi tarik 4 dwe mar abich higa mag 2023.
We have given the county enough time and we now think it's now time for them to act, and we'll be therefore withdrawing our services from 3rd March at midnight. The issues at hand that we found to be of serious concern to our members is the issue of medical cover. As doctors, Kericho County does not have a comprehensive medical cover for its doctors, despite the fact that they provide the service of being healthcare workers and doctors. So actually they are providing a service that themselves they cannot afford. So for that reason, we'll not have any reason, if that particular matter will not have been resolved, we'll not have any reason to be at work after the elapse of 14 days.
Tino Daniel Uma, Ramogi TV.
Governor Machon Makiambu Ferdinand